The American Heart Association says that you can reduce your risk factors by quitting smoking, managing your blood sugar and blood pressure, lowering your cholesterol, and staying active.
According to dentists, periodontal disease or gum disease is an epidemic throughout the country, and studies show that half of the population over the age of 30 has this.
So the good news is that it's entirely treatable. And News Channel 2's Brent Carney visited a local dentist that's using an innovative technology to treat this disease. Brent.
Well, Don, it's called the Lonap protocol. It's a type of laser treatment that rids your mouth of gum disease. Now, this isn't the type of laser that you see in the movies. It's much smaller, and depending on the patient, the treatment can be relatively painless. Dr. Melnick of New Hartford has been in practice for 36 years. He's been treating patients with periodontitis or gum disease with scalpels up until 2011, when he discovered something new. Now he's one of only 3 dentists in the area trading his scalpel for this, a laser called Lonap.
Well, we've been using it for 7 years, and to be honest with you, it's almost like I started a new career. It is so much more pleasant for the patient, which makes it so much more pleasant for me.
Periodontitis is a form of gum disease that damages the tissue in your gums and can also destroy the bones supporting your teeth, leading to tooth loss. Dentists say the worst part of this disease is that it can be relatively hard to see.
Periodontitis, unfortunately, is painless. And so most people, why do we have such high levels, such a prevalence of this disease in this country, is that it doesn't hurt. And we have this thought that if there's no pain in my mouth, everything's okay. And the mouth doesn't work that way.
Experts say treating periodontitis using Lonap becomes one of your best options.
We use a laser fiber that's about the thickness of 3 human hairs. And we go under the gum line. It kills the bacteria that are causing the periodontal disease. It zaps the diseased, inflamed, infected tissue, but leaves the healthy tissue alone. So recovery is much faster, less recession, less discomfort, and remarkably, there's even the chance that some of the damaged tissue, some of the bone damage that occurred reverses with one treatment.
And now the warning signs that you definitely want to look out for is if you're brushing or flossing and you're bleeding from the gums. That's definitely something that dentists want you to definitely call and contact them about. But it's nothing to really worry about, just something that you should have looked at if that happens.
And you mentioned, you said the treatment's been around for a while. What's the success rate on that?
Well, Dr. Melnick, actually, that I talked to, said that he's treated up close to 1,000 patients right now successfully. And later on, we're actually going to be hearing from some of them as well.
Looking forward to that coming up on News Channel 2 at 6. Brent Carney reporting live. Thank you. Still ahead, a trial date is set for